Ladies and gentlemen, thank you for standing by and welcome to the COVID-19 media briefing conference call. At this time, all participants are in a listen-only mode. After the speaker presentation, there will be a question-and-answer session. To ask a question during the Q&A session, you will need to press star and then the number 1 on your telephone. If you require any further assistance, please press star 0. And please be advised that today's conference is being recorded. And now, I would like to hand the conference over to your speaker today, Michael Schomer. Thank you. Please go ahead, sir.
Thank you for joining us for the COVID-19 media call for October 12th. We'll start today's call with a situation report from Health Commissioner Jan Malcolm and MDH Infectious Disease Director Kris Ehresmann. We'll also hear from MDH Office of Health Facility Complaints Director Lindsey Krueger and Christine Dahlman, the Executive Director of a long-term care facility called Springbrook Village in La Crescent, Minnesota. After that, we will take questions from reporters on the line. With that, I'll now turn it over to Commissioner Malcolm.
Thank you, Mike, and good afternoon, everyone. Around the world this morning, we are now above 37.5 million cases of people with confirmed COVID-19 disease and over 1 million deaths. In the United States this morning, we're above 7.7 million cases and 214,000 deaths. Our case growth in the United States has picked up pace again and now appears headed for surpassing the growth rates of the first wave in the spring. Here in Minnesota, over the weekend, we reported almost 3,000 new confirmed cases on about 30,000 tests each day and 20 additional deaths over the weekend. Today, we're reporting an additional 1,178 cases on a testing volume yesterday of just under 18,000. And sadly, 3 more fellow Minnesotans have died of COVID-19 disease. This brings us to a new total of 113,439 cumulative cases in Minnesota, and 2,144 of our fellow Minnesotans have died. There have been a cumulative total of 8,421 patients hospitalized from this disease, and 2,311 have required intensive care. There are 444 people in the hospital now, 137 of them in intensive care units. Those numbers have stabilized a bit in the last few days after some larger increases last week. Now, as I mentioned, this 1,178 new cases yesterday comes on the heels of additional high growth days. This is now our 5th consecutive day of over 1,000 new cases, topped again by the report on Saturday, a record high of over 1,500 cases on Friday alone. And these numbers clearly show that despite what we wish was the case, COVID-19 is still a big and growing problem in Minnesota. What we've seen happen in Wisconsin and literally pretty much every state around us is a cautionary example of how quickly things can get even worse when a state is seeing uncontrolled community transmission. Week over week, we've had an increase of 8.3% in our laboratory confirmed cases. Week over week, we've had a 7.9% weekly change in testing volume. This is the first time in my memory, Kris might correct me, that we've actually seen a larger growth in cases than in testing. Our 7-day average testing positivity rate remains at 5.0%. And we've been above this level of 5%, which we consider to be a caution threshold for 16 days now. So that is continuing to tell us between the relationship between case growth and testing volume and this persistent test positivity rate that there's just a lot more disease out there than we have seen in the past. With that, I'm going to pass it to Kris.
Thank you, Commissioner. I just wanted to provide a couple of updates. First, we've had a lot of questions about some of the political rallies that have been held, so I just wanted to provide folks with information on that. We have identified 3 cases who reported attending the Trump rally at the Duluth airport. However, 2 cases are in the same household, so at this point we would not consider that an official outbreak because we do have 2 household members, but 3 cases with the most recent Trump rally in Duluth. We have 3 confirmed cases who report attending the Pence event at the Minneapolis-St. Paul International Airport on September 24th. Those are 3 separate households, so we would consider that. And one of the cases also did attend the Trump rally in Duluth. And then we had talked earlier about Trump events in Bemidji, and we've added 4 new cases who indicated that they had attended the Trump events on September 18th. So we have a total of 12 cases who attended the rally at the Bemidji airport, and then we have 4 cases who reported attending a counter protest at that same time. So a total of 16 that were involved in events for that. And then we have a total of 2 cases that reported attending any events related to Vice President Biden. They were separate events. One person attended an event on September 16th in Duluth and one on September 22nd in Brooklyn Park. And then I'd like to just shift gears. As you heard, our focus today will be talking about our long-term care facilities and guidance. And so I just wanted to provide a bit of update, some data in that area. We have had a total of 2,004 facilities who have had confirmed cases or exposures. I think it's important to keep in mind that of those, 181 facilities had only resident cases, 1,044 had only healthcare worker cases, and then 779 had both resident and healthcare worker cases. Currently, we have 245 long-term care facilities that have had a positive COVID-19 case in the last 14 days. 140 of them are nursing homes, and 105 are home care providers or assisted living. Just as a baseline, keep in mind that we have 364 nursing homes in the state and almost 1,700 home care or assisted living providers. If we look at just the outbreaks that we've seen across the state since the beginning of the pandemic, it's important to keep in mind that 72% of these outbreaks have had fewer than 10 cases, and in fact, 43% have had only a single case identified. And then because county positivity is important, as Lindsey will be providing her data, I'll just point out that we have 2 counties, Martin and Redwood, that have county positivity rates that are higher than 10%. 40 counties have rates between 5 and 10%, and 45 counties have rates that are less than 5%. So with that bit of background, I will turn it over to Lindsey Krueger.
Thank you, Kris. We need to start this update by acknowledging the incredible work that has gone on in recent months, not only among those in public health, but also very impressive work that has been done by the long-term care facilities themselves, staff, and workers to protect residents from COVID-19. We see the positive results of this in recent nursing home data from the Federal Centers for Medicare and Medicaid Services for the week of September 27th, which showed that Minnesota is currently 40th nationally at this time in resident cases per 1,000 residents. Minnesota is averaging 100.9 cases per 1,000 residents. However, we cannot afford to let our guard down, especially given the high rate of community transmission we're seeing across much of the state. But we do need to give credit to all of those who've worked hard to keep COVID-19 from our long-term care facilities amid incredible pressure. Turning to the topic, I'm here to update you on today, you'll remember that in the past months, we've talked about the importance of balancing COVID-19 safety and visitation restrictions with the well-being of the residents in long-term care and other residential settings is an urgent priority for Minnesota. We know that social isolation because of COVID-19 visitor restrictions is a significant concern. The Department of Health developed visitation guidance that was released in August of 2020. However, on September 17th, last month, CMS released nursing home-specific guidance to allow for more visitation. In light of this new federal guidance that was specific to nursing homes, we are releasing updated visitation guidance for home care providers in assisted living facilities to line up consistently with CMS's guidance. This guidance will replace the guidance from August. The guidance that we posted today will now indicate if facilities, including nursing homes and assisted living facilities, have not had a COVID-19 exposure in the last 14 days, broader visitation must be allowed. Facilities are in 3 risk categories: low, medium, and high, based on community transmission as measured by county COVID-19 test positivity rates. Facilities without recent cases in areas with low or medium level community transmission must allow visitation unless they have a reasonable or clinical safety cause not to, such as a staffing crisis. Facilities in the high category will not be able to allow for broader visitation. We will continue to allow essential caregiver and compassionate care visits without changes. We do continue to have our outdoor visitation and window visitation, but we also know what the upcoming cold months will bring for weather and temperatures. Visitors need to continue to follow core principles of infection control, including masks and proper infection control. This is very important for the residents and the staff of these long-term care facilities. Guidance was posted today and will be effective on this coming Saturday, October 17th. And with that, I'd like to now turn it over to Christine Dahlman. Christine?
Hi. I would like to talk a little bit about the visitor policies that we have implemented from the guidance that the state of Minnesota had given us. We did start essential caregiver visits end of July, and then also we did broader visitation visits starting September 1st, where we were actually able to move to the level 2 and allow general visitation to our residents. We were able to stay at that for about 3 weeks until we ended up having to go back to a level 1 where we had to restrict the visitations back to essential caregiver visits, window visits, outdoor visits, things like that. We are a facility that is only 5 miles away from La Crosse, Wisconsin. As most people know, that has been one of the hot spots around the country for COVID, and we have about half of our staff come from La Crosse to work here. We know that it was a little bit of a risk to be able to do these extended visitations for our residents, but we did feel that the benefits for our residents outweighed that risk. As long as we were doing things according to guidelines, following the proper PPE for our staff, our visitors, are doing the proper sanitation, we were able to keep that risk at a minimum, and our residents were able to finally connect with people that they haven't connected with in a long time. It was a big appreciation from the residents when we were able to allow them to see some of their long-term friends face-to-face, things like that. You know, we do have a memory care unit here, and the outdoor visits were great for some individuals, but they still missed some of the closer contact. One of them really had an issue with window visits and couldn't understand the fact why her family member was outside the window and couldn't come in there and see her, and it would just cause more agitation. So when we were able to broaden it to essential caregiver visits and also the general visits, it was like a light came back on in her life, and it really made a difference in the quality of their life and to be able to see those things. So we were very, very glad that we were able to do that. Going from the levels is a very fluid thing, so we're constantly monitoring the positivity rating around here, also the hospital capacities. We're watching what's happening in La Crosse to see what's going on and how that can affect our residents and visitors, things like that. We do an update weekly to our families, residents, and staff to let them know what kind of level we're at and what kind of visitations that we can allow. So that way we try to keep everybody as up to date as possible and as safe as possible. We want our residents and our staff members to be as safe as possible, but we also know that they do need a quality of life as well, and being able to allow these visitors definitely adds to that quality of life for them. And I guess with that, I'll turn it back over to Mike.
Thank you, Christine. Operator, we're ready to take questions.
As a reminder, to ask a question, you will need to press star and then the number 1 on your telephone keypad. To withdraw your question, press the pound key. Our first question comes from Jeremy Olson from Star Tribune. Your line is now open.
Commissioner, at the start of this conversation, you said that we now appear to be headed to surpass the first growth wave we'd seen in the spring. Is it apples to apples to compare those times in terms of the threat level to the community? I mean, that was at a time when we were testing about 1/3 of the people that we are now. So are we just testing more, finding more, or is there as much or more of a threat regarding COVID-19 right now than there was back then?
Thanks, Jeremy. That comment was in reference to the total nationwide rate of growth, that we appear to be on a pace to surpass the rapid rate of increase that we saw nationwide, which early on was driven sort of by the Northeast and now is much more widespread across the country, as you know. But here in Minnesota, I think the story is absolutely that we're testing many times more people than we were in the spring. But we also know, as Kris has talked about many a time, that the nature of the case growth and spread is quite different now than it was then. It's more widespread in nature, more widespread across the state, more widespread across demographic groups, and much, much more spread just happening from people interacting in the community rather than in specific kind of known higher risk settings for transmission. So both are true. We are testing more, expecting to find more, and looking for it. So it's a good thing to be finding the cases that are out there. But we absolutely do believe that the prevalence of the virus is quite a bit more extensive now than it was. Kris, I don't know if you'd like to add.
No, I think that's really accurate. And just to say that we're now, what we're concerned about now is that, as the commissioner said, in the spring when we were seeing our case growth, yes, we had limited capacity for testing, but the cases were all being seen in not necessarily closed settings, but certainly settings that were very focused, whether it was our long-term care or our congregate living, correctional, or certain workplaces. And now we are past seeing spread in those very focused places, and we are seeing it everywhere. And I think that is what is very different. All of those partners, as Director Krueger said, our long-term care partners have made huge efforts to make a difference, and we've seen reduction in spread there. Our workplaces have taken steps to be safer, as have our corrections partners. So we're seeing gains there, but we're seeing this widespread transmission in the community. So it's not focused, it's everywhere, and I think that's what's really concerning.
I guess my follow-up question is, it seemed like in April, early May, it was the month to talk about outbreaks in food plants. And in July, we were talking about restaurants and bars. And some of that just with the passage of time, we have new things to talk about. But are those still issues? Are food plants still at risk in having substantial outbreaks? Are bars still, even if we haven't asked about them as much, are they still as much of a risk or an engine for COVID growth as we had seen in the midsummer?
Kris, can you take that one and maybe just update a bit on the type of community spread you're seeing?
Sure. We are seeing less transmission, related to processing and manufacturing plants, as you talked about, that we were seeing in April, in part, as I said, because these partners have made changes. We continue to see increases in cases associated with bars and restaurants. That has slowed a little bit. I think that those, operators have kind of learned from our experiences and the things that are important for them to do to help limit transmission. But we are continuing to see cases associated with those things. But as you said, it's sort of this moving target. And so we moved from that, and then schools came into session, and so we've got many more, obviously, locations for potential transmission. But definitely we're continuing to still see things associated with bars and restaurants.
Thank you.
Our next question comes from Peter Cox with Minnesota Public Radio. Your line is now open.
Yeah, I'm wondering if the changes in long-term care and the visitation rules, are they in response to federal guidelines? And would I be right to say that?
This is Commissioner Malcolm. I'll start, and then Lindsey or Christine, you can certainly add. Yes, since federal guidance is required of skilled nursing facilities, we thought it was important for us to continue to update and try to make sure that our guidance is in line with those federal requirements. And again, because we know the similarity in many respects between the types of folks who are served in assisted living and home care facilities, we wanted to make sure that the same general framework was in place there. Lindsey, would you add anything?
No, Commissioner, I think you did a really good job. Just to reiterate, the federal guidance from CMS is for nursing homes specifically, and so that guidance allows for broader visitation. Now, we revised and brought out this new guidance for home care and assisted living providers to ensure that there was consistency for visitation in nursing homes and in home care providers, so one setting didn't have differing visitation guidance than another.
Just to follow up on that, with cases going up in our state and in the region, I'm wondering if the federal government wasn't doing this, would you be easing restrictions at the time, especially just given the numbers of cases we've seen in recent days?
This is the Commissioner. That's a very good question. Hard to speculate on that, other than to say, as I think Lindsey said in her comments, this has been a goal of ours to continue to evolve this guidance and to try to create a framework that would, within the ability to manage the risk. And I think Ms. Dahlman did a great job of explaining this, that we know the benefits of increasing social interaction for residents of long-term care. We know the health consequences directly of isolation. So it's certainly been a goal for all of us to work toward creating a framework for visitation when the risks that we understand are there can be managed. So I think it's consistent with the direction that we wanted to go. I think it's probably fair to say the timing was somewhat influenced or in many ways kind of dictated by the federal guidance coming out.
Thank you.
Our next question comes from Paul Scott with Forum News Service. Your line is now open.
Hi, I saw that Washington County is kind of spiking today. There's 142 cases. Do you know anything about that?
Kris, can you comment?
Well, we know that there are more cases. I will run a quick check while we go on to the next question, and we'll give you a quick answer.
Thank you.
Again, if you would like to ask a question, press star and then the number 1 on your telephone keypad. Our next question comes from Courtney Godfrey with Fox 9. Your line's now open.
Yeah, 150 million COVID tests were distributed by the federal government to assisted living communities, I think in mid-September. I think they were notified of it in the beginning of September. Does this have anything to do with allowing more visits? I mean, if you're able to test, do a rapid test on a family member coming in, does that have anything to do with this new guidance?
This is Jan. I'll start, and then Lindsey, if you could comment further, or Kris, that'd be great. I think certainly the ability to test and to test workers as well as residents as well as visitors when appropriate is tied to the ways in which we can assure that risks are able to be mitigated, if you will, as Christine Dahlman said. So I think in terms of the specifics of those tests, I don't know if the federal government would say it's those tests specifically, but I think certainly making more different types of testing platforms available has been part of the Minnesota strategy. But in terms of what tests are best suited for what purposes, I think that's an ongoing discussion. Lindsey or Kris, anything that you would add?
This is Kris. Oh, go ahead, Lindsey.
No, okay. I was just going to mention that in our guidance, we do have a section on visitor testing. And while it's not required, we do encourage facilities in medium or high positivity counties to test the visitors if they're feasible, if it's feasible and they're able to do so. So like Commissioner Malcolm stated, testing is a great way to help identify COVID and reduce spread. I'll turn it over to Kris if you have any other comments.
Oh, yeah, I was just going to say that I think one of the considerations is I think it's important for individuals, as we put in our guidance, who are working in long-term care and residents of long-term care and even family members to get tested so we're aware of what's going on. The challenge with some of the antigen tests that have been made available are that they're really designed more for testing of symptomatic persons, and so there can be some challenges with using them to screen asymptomatic individuals, and so that's something that whenever we have a test that's available, we have to kind of make sure that we're weighing, where is it best utilized to help us understand what's going on. And so that's a consideration that we have to keep in mind as we're thinking about some of these tests.
Operator, we have time for one more question.
Yes, our last question comes from Jeremy Olson with Star Tribune. Your line's now open.
Yeah, I just wondered how much guidance you have or interaction you have with Minnesota's professional sports teams. The Vikings obviously had a situation a couple weeks ago where they played against a team that had some COVID cases, but then they were able to play 7 days later, which would be obviously shorter than the standard quarantine. Right now, Minnesota United has a case where they've canceled a game and their return to play is unclear. I'm just wondering, with the Vikings, Minnesota United, any of these teams and their return to play decisions and return to event decisions, do they consult with you? Do you provide any guidance to them?
Kris, can you take that?
Yep. Yes, certainly we are aware of the cases. So as you said, with Minnesota United, we're aware of the cases. But these professional organizations have their own internal protocols that they are following, and they also have their own testing regimens and things. So yes, we share our guidance with them just like we do, with everyone. But they have some unique situations in which they've got almost more strict guidance for their team members than what we'd see in the general public, and so they're operating under those protocols.
And also, would you have gone for it on fourth down or kicked a field goal? No, just kidding. You don't have to answer that.
oh boy, I certainly could give you an answer to that one. We're all Monday.
Never mind.
Monday
I withdraw.
Quarterbacks. You withdraw. Me too.
I think we're all glad for a question that's not related to COVID, and I'll just let Paul Scott know that we will reach out to you separately. I'm still getting that information and did not forget.
Okay, well, that is all the time we have for today's call. We do invite any reporters with additional questions to reach out to our communications office this afternoon. Have a good day, and we will be back with you again soon.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect. 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 Disconnect.